Do you keep getting UTIs even though you're doing everything right? You're not dirty, and you're definitely not alone. Women are up to 30 times more likely to develop urinary tract infections than men. The biggest reason is simple anatomy. A woman's urethra, the tube that carries urine out of the body, is only about 4 centimeters long, while in men it's around 20 centimeters. That means bacteria have a much shorter journey to reach the bladder. The urethral opening is also much closer to the anus, where common bacteria like E. coli normally live. So even with excellent hygiene, bacteria can accidentally enter the urinary tract. It's biology, not poor cleanliness. But anatomy isn't the whole story. Ever noticed you get a UTI after sex? There's actually a scientific reason why. Sexual activity can gently push bacteria toward the urethra. Because the female urethra is so short, those bacteria can quickly reach the bladder. That's why many women develop what's sometimes called a honeymoon UTI. This doesn't mean sex is unsafe. Doctors often recommend urinating soon after sex because it helps flush out bacteria before they have time to multiply. Staying hydrated also helps keep the urinary tract clean, but there are other surprising triggers. If you've reached menopause and suddenly keep getting UTIs, your hormones may be the real reason. Estrogen doesn't just affect reproduction. It also keeps the tissues around the bladder and urethra healthy. After menopause, estrogen levels fall. The protective bacteria in the vagina decrease, while harmful bacteria find it easier to grow. The bladder lining also becomes thinner and less resistant to infection. That's why recurrent UTIs become much more common after menopause. Think holding your pee is harmless? Your bladder disagrees. Several daily habits can quietly raise your risk. Not drinking enough water means bacteria aren't flushed away. Holding urine for long periods gives bacteria more time to multiply. Some spermicides can disturb the natural balance of protective bacteria. Diabetes, pregnancy, and kidney stones can also increase the risk. Small habits can make a surprisingly big difference. If your UTI keeps coming back, don't just keep taking antibiotics. Most UTIs improve with the right antibiotics, but repeated infections may signal an underlying problem. If you have fever, chills, severe back pain, blood in your urine, or infections that keep returning, it's important to see a healthcare professional. A kidney infection can become serious if left untreated. The earlier it's treated, the easier it usually is to manage. UTIs are incredibly common, especially in women. They're usually caused by biology, not poor hygiene. Knowing why they happen can help you prevent them and seek treatment before complications develop. Biology explains, compassion understands. Subscribe for more science-backed stories.